Hi everyone, I'm Rabia.
And I'm Anna. Today we're going to talk to you about oral cancer because November is Mouth Cancer Action Month.
Both of us see patients in practice diagnosed with mouth cancer, and just this month I've had 2 patients come back after mouth cancer surgery. One lady had part of her tongue removed and now needs to relearn how to speak again. The other lost 9 of her teeth, and with that her confidence and her ability to smile. Both ladies had part of their skin removed from their forearm and grafted into their mouth, and now they have hair growing inside there.
Last year, over 8,300 people were diagnosed with mouth cancer. Sadly, a third of them lost their lives. That could be your sibling, your friend, or a parent.
Do you smoke or do you drink alcohol? Then you're 30 times more likely to develop mouth cancer.
And have you heard of HPV? That's the human papillomavirus. It's a sexually transmitted disease and one of the increasing risk factors for young men and women developing oral cancer.
But if you think none of this applies to you, think again, because 25% of people diagnosed with mouth cancer had no identifiable risk factor. So it could be you. This is why, if you're over 16, once a year, go see your dentist for a screening.
In between seeing the dentist, when you see the hygienist, if we see anything that we're suspicious of, we'll either let the dentist know or we'll refer you on ourselves.
Now pay attention, because Anna here is going to do a quick self-demonstration of a technique by Mouth Cancer Foundation called Bite Back at Mouth Cancer. It takes 2 minutes, you can do it in the comfort of your own home and examine for any lumps and bumps, and this could save your life. At every step, look for any lumps or swellings, red or white patches, changes in texture, persistent ulcers, or anything out of the ordinary. So let's start. Examine your face. Anything unusual? Any swellings you haven't noticed before? Moles that have become larger, itch, or bleed? Now examine your neck. Like Anna, feeling along the muscles for any lumps or swellings. Now the lips. Pull each lip outwards to look inside for any sores or changes in colour. Next, use your thumb and forefinger to feel around the inside of your lips, looking for lumps, bumps, or changes in texture. Now do the same for your gums. Look at them. Feel them. Now the cheeks. Right, then left. Look for any red or white patches and use your finger in the cheek to check for ulcers or lumps and bumps. Time to examine your tongue. Stick your tongue out. Move it right, then left. Look for any swellings, ulcers, or change in colour. Inspect the top of your tongue, and then place it to the roof of your mouth to examine the underside of your tongue. While your tongue's up there, look at the floor of your mouth. Any unusual colour changes? Gently press your finger along the floor of your mouth and the underside of your tongue. Feel for any lumps, swellings, or ulcers. Lastly, the roof of your mouth. Tilt your head back and open your mouth wide. Examine the roof of your mouth. See any changes in colour or ulcers. Feel for any changes in texture.
Other signs to look out for are ulcers or red and white patches in the mouth that don't heal after 3 weeks.
A lump or swelling in the face, jaw, neck that hasn't healed for 3 weeks, or a sore or tight throat that hasn't healed for 6 weeks.
Also, if you notice you're having problems with swallowing, chewing, moving your tongue or jaw, this could also be cause for concern. Take note, is there any numbness in your tongue or other areas of your mouth?
To prevent mouth cancer, the best advice I can give is stop smoking, and don't use tobacco in any of its forms, whether you chew it or smoke it. So those who chew pan, you know who you are, you've got to stop.
The Mouth Cancer Foundation advises no alcohol. However, if you do drink, remember, it's 14 units per week. That's 4.5 pints of beer or 7 regular glasses of red wine.
A healthy balanced diet also goes a long way.
Try the Bite Back at Mouth Cancer Challenge today.
Okay.